Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. It is the 23rd of December, and yes, RI Elder Info is still working, even though we are cruising right into the holiday weekend. I am Deb Burton, the Executive Director of RI Elder Info, and every Friday at 9 a.m., I come on here and I interview different people and organizations that you or someone you know needs to know about. So hit the like button, hit the share button, because we're going to be talking about something really important for many, many, many Rhode Islanders today, and it's really important that you help us get the word out. So as you all know, we are a 501c3 nonprofit, and we can't do our work without your support, as well as the support of our sponsors and our regular donors. So big thank you to Aetna Insurance Company. They're wonderful Medicare providers here in the state, United Healthcare, Oak Street Health. We would like to also thank Tamarisk Assisted Living Facility and 321 Media. They are what is making this look great behind the scenes. And England Studio, they are an award-winning web design team located right over here in Quonset, and they can build you a website that is user-friendly and quite possibly award-winning like rielderinfo.com is. So this week, we are speaking with Victoria Parker, the Rhode Island Department of Health's Alzheimer's Disease and Related Disorders Program Manager. Hi, Victoria.
Good morning. How are you?
Awesome. How are you today?
Good. And I got here safely in the storm and wind. Didn't lose power or anything.
So far, so good. So tell me, the Alzheimer's Disease and Related Disorders Program, what is that here in Rhode Island? Is that part of the Rhode Island Alzheimer's Association?
Mm-hmm.
What is it?
Sure. So the Alzheimer's Disease and Related Disorders Program, and we like to use acronyms, so we call it the ADRD program, is new to the Rhode Island Department of Health. So I am an employee of the Department of Health, and I oversee this program, which is completely funded through the Centers for Disease Control and Prevention, or CDC, as you may know them. We applied to the BOLD funding opportunity through CDC back in 2019, and we were awarded as a state health department in 2020. And CDC gave out a lot of awards to states all across the country. And Rhode Island was lucky enough to be one of 5 states that applied to receive, we call it enhanced funding, but essentially the highest level of federal funds that we could possibly receive as a state. And we use our program to essentially address Alzheimer's disease and other dementias through what we call a public health approach. Which can mean a lot of different things. And you mentioned the Alzheimer's Association, and we have one here in Rhode Island, and they are one of our closest partners. Very grateful for their partnership as we look to do more in the community and support different events that they might put on and really just be a great partner. So we are different from the Alzheimer's Association, but we certainly partner with them a lot.
That's awesome. I can tell you, Annie and Donna over there at the Rhode Island Alzheimer's Association are amazing. So since the state got this funding, are we creating like a statewide plan on Alzheimer's? What's the goal of the funding, and how does that roll out? How does that impact people?
Yeah, so we do have a state plan. I'm glad you mentioned that. We have a state plan on Alzheimer's, which was updated in 2019 by then Lieutenant Governor, now Governor Dan McKee, and a team of people. And that state plan really serves as a guide for statewide decision-making about dementia and how to care for people living with dementia and their caregivers, and what does that mean for the health system that cares for these people. So it's really used as a guide for statewide planning. It was last updated in 2019. And the Alzheimer's program at the Department of Health uses the state plan to sort of prioritize different projects that we might be working on. So, for example, some things you might find in the state plan, if you were to read it, is some information about high-risk populations. And it's true that there are some health disparities related to dementia. Blacks and African Americans, that community is 2 times as likely to have dementia than their white counterparts, and Hispanics are 1.5 times as likely. So there's some significant health disparities, racial health disparities that are accounted for when dealing with Alzheimer's disease and other dementias. So in the state plan, we talk about ways that we can possibly address those health disparities by, really understanding the needs of those communities, how to promote information about brain health and things that you might be able to do to help you prevent or prolong your condition, and also participate in clinical research trials, because it's also true that members of the Black and Brown community are not participating in research or clinical trials for a lot of reasons that are 100% valid. And so in the state plan, we talk about different strategies to increase diverse populations who we see participating in different clinical studies and other trials. And that also then goes into our state planning and our Alzheimer's program within the Department of Health. So sort of thinking through how to really address those health disparities and think through high-risk populations, how we might be able to offer some support through the public health department. So we kind of use the state plan not only as a guide just for statewide planning efforts, but also as a guide to sort of prioritize certain initiatives through the Alzheimer's program at the health department.
That's a lot. And I think it's very interesting that a lot of times people don't realize that there are these healthcare disparities in historically underserved populations. And so does the Rhode Island Department of Health, is it creating programs or is it partnering with community organizations to help reach all Rhode Islanders? How is that actually working? Like, how is it operationalized?
Yeah. So I'm going to answer this question in a couple of different ways. So bear with me here. But when I tell people that I work in public health, I think the immediate thought that comes to mind is I give vaccines, or I test water, or I test soil. And that is true. Some of my colleagues at the Department of Health do that work and support that work. But there's a whole other part of public health that really involves chronic disease. And there are a lot of chronic disease programs within the health department. Alzheimer's disease is one of those programs. But the CDC also funds diabetes, heart disease, stroke, cancer programs, asthma, arthritis. And those are all sort of our partners within the chronic disease department, if you will, within the health department. So I think a lot of people maybe don't know that chronic disease is a part of public health, and that is what your state health department, that's a part of what we do. And it's interesting. I heard at a conference once that a health issue becomes a public health issue when the burden is large, the impact is major, and there are public health ways to intervene. And that is exactly what we're seeing with Alzheimer's disease and related disorders. The burden is large. There's 24,000 people, according to the Alzheimer's Association, who live in Rhode Island who have Alzheimer's disease or another form of dementia. And we know that that's only going to increase. We also know that a lot of people are not diagnosed or maybe misdiagnosed. So that 24,000 is even sort of a low ball of what the actual number is in Rhode Island. The Alzheimer's Association, through their facts and figures report, also tells us that there's going to be an increase in people with this condition. So it's only going to get worse. The burden is going to only grow. So the burden is quite large. And the impact is major. So In Rhode Island, we know that there's about 40,000 caregivers who are informal caregivers. They're not paid or professionals, but they are a family member, maybe a spouse, a loved one, a daughter, a son, whoever, a neighbor even, who is providing unpaid care to their loved one who has this condition. And we also know that people with dementia often require 24/7 round-the-clock care, especially for those who are more advanced in their disease process. So the impact's really major because there's so many informal caregivers and they're providing literally billions of dollars of unpaid care. And our health system is maybe not yet set up to really respond to that just yet. So the burden is large, check. The impact is major, total check. And the third thing is that there is a public health way to intervene. And what we mean by that is connecting partners, convening key stakeholders, and really taking our approach to dementia care out of the facilities or settings and really making it a community response. So, knowing that people in your community have dementia and you can be a part of caring for them or just being respectful of their space because they do the things that everyone wants to do. And thinking through how to change the way that we deliver care for people with dementia, how we diagnose people, what happens after a diagnosis. So those are all sort of the public health ways that we can intervene in terms of the health issue and sort of how it becomes a public health issue. So I don't know if that really answered your question, but I just like to explain to people that public health is more than just giving vaccines and lead poisoning. It does involve this chronic disease part, and there are certain things that we can do in the public health world to really address health issues.
Yeah, I think a lot of folks, maybe their first hearing regarding public health had to do with the overall response for COVID. We hear about the public health and COVID and all of that. Throughout COVID, and now that we know how to be COVID safer, has there been an increase in diagnoses of dementia, whether that be Alzheimer's or one of the other related dementias? Like, are we seeing any changes due to COVID in Alzheimer's?
Mm-hmm. Yeah, there are some statistics about COVID mortality rates, and for people who had dementia, it did increase during the COVID pandemic. Sadly, I'm assuming many of them were living in nursing homes. And of course, we know what happened with COVID in nursing homes. It's so devastating. So that, I think, contributed to part of that increase. But in terms of diagnosing, age is the biggest risk factor for dementia. So
I want to interrupt.
Yeah.
Is it sort of if age is the biggest risk factor, does that mean if you live long enough, then you will get Alzheimer's, period? Or is that sort of it's one of the things that could happen, like arthritis or things? It's not guaranteed to happen with age.
Right. It's the second one. It is not a guarantee. As you get older, there is no promise that you are going to get dementia. There's actually a really great educational session through the Alzheimer's Association and their Rhode Island chapter. They've got a great website where you can download educational sessions and other flyers and information. And it kind of goes through what is normal aging and what is dementia. And I think a lot of times what I hear in the community is, I forgot my keys, I must have dementia. And that's that is a normal part of aging. Even as a young person, although I'm also aging, I also forget my keys. And sometimes I forget what I had for breakfast, but that doesn't mean that I have dementia. So there's a lot of information, and I totally recommend checking out the Alzheimer's Association website because they are accurate and they have a lot of helpful tools. And you can sort of read about, what's normal aging and what is aging with dementia, and when should I start to worry, or when should I start to speak to my primary care doctor about some of the changes that I'm noticing. But it does not mean as you age that you are surely going to have dementia. Sadly, it does happen. But It's definitely not a guarantee. But your question about are we seeing more cases? And my answer to that is as the aging population grows, and of course we have a huge influx of people who are aging above 65, with age being the biggest risk factor, we will see more people with dementia, because that we know that as with age as the biggest risk factor, there'll be more diagnoses and more cases. So that kind of goes back to the burden. The burden is really large, and it's only growing because of our aging population.
So we have been really successful at helping people live a long time.
Mm-hmm.
And to live a long time with chronic illnesses, because dementia is not going to get better. And so when was the state plan put in place? How often is it going to be reviewed again? And does it really look at all of the global systems of the state? Because I know the governor's made a commitment to creating a statewide plan on aging, and I would imagine that this would kind of fold nicely in it as something that impacts individuals who age.
Mm-hmm. Yeah, so the first state plan, to my knowledge, was drafted in 2013 by the Lieutenant Governor's office. It was then Elizabeth Roberts, and she and her team created the first state plan to address Alzheimer's disease. And then 5 years later, the 2019 update came to be, and it includes a number of recommendations. So we mentioned high-risk populations. There's also some recommendations related to establishing and growing and enhancing a workforce that is prepared to care for people with dementia. There's also some information about public education. There's a wonderful evidence-based program called Powerful Tools for Caregivers that is evidence-based and proven to support people who are caregiving informally for their loved one with dementia. So there's different recommendations about what we could be doing really to address Alzheimer's disease in Rhode Island. It's sort of, the state plan is overseen by a legislatively mandated Alzheimer's disease and related disorders advisory council. So there are members of this council, which, because it's legislatively mandated, that means literally by law, we have to have this council in place. And we have a number of appointed members who are appointed by the governor, the lieutenant governor, other members as well. And so we've got this really great diverse group of stakeholders as council members who sort of are responsible for understanding what's in the plan and then helping to update that plan. Because the last update was 2019, we're coming up on our time for a new update. So in our advisory council, which the Department of Health and me and my program sort of helped to facilitate, we have been reviewing our progress in terms of meeting the recommendations that were in the 2019 plan and kind of thinking through what should be included in the next round of updates. And you also mentioned the state plan on aging, which the Office of Healthy Aging is helping to update as well. So we've been talking a lot with the Office of Healthy Aging staff and collaborating with them to make sure the updates that we're putting in the Alzheimer's state plan are really aligned with our overall state plan on aging. And that means, using the same language to describe things, pulling from the same data sources to be consistent, using the same acronyms even. How confusing can it be, right, to read some of the information that comes out? So definitely some efforts are being made to align with the state plan on aging. And our advisory council is not only accessible to the appointed members, any member of Rhode Island, any member of the public can join our advisory council as a public member, and they can provide input just as an appointed member can. So we typically meet on the second Wednesday of every month and at 9 a.m. And there are virtual options to attend as well. And if there's any of your listeners who are interested in seeing what we do in the advisory council and what our state plan on Alzheimer's is sort of coming to be, we'd be happy to have you included in that. And you can also check out the Secretary of State website. We post all of our previous minutes and meeting notes and agendas are on there. So if that's something that's interesting to you, if you're interested in state planning, if you want to hear more about what the Advisory Council is doing, they are open meetings, and we invite anyone to join us, because really the input of the community members is something that we value.
On the planning board, are
Mhm.
there individuals who have dementia, who have lived experience of being an individual with dementia? And are there caregivers on the group to provide that lived experience of caregivers taking care of an individual with dementia?
Yeah, good question. So one of our officially appointed members, and this is written in Rhode Island law, that we have to have a person with lived experience on our council who is officially appointed.
Mhm.
And we do have a caregiver who cared for her loved one who sadly passed away with dementia. And she brings that perspective of somebody with lived experience. I think often in councils like this, we tend to talk at a very high level about what is needed for people living in Rhode Island with dementia. What about caregivers? And we have this perspective from we provide care to people. We want to provide education and programs to these people, but we have sometimes missed that perspective of, I actually lived this. I actually cared for my husband, my spouse, my loved one. And that is the perspective that has been missing. And we're really, really grateful for her participation on our council. And with that said, she actually just sent me a message last week to invite some folks that she knows who also have lived experience as public members of the council as well. And I have to say, people with lived experience are not shy, and they bring real stories and real information that's so helpful to our planning process and just helpful to us as a council.
Yeah, I would think a lot of times state agencies develop things that
Mhm.
look really good on paper
Yeah.
and seem like they ought to work perfectly in real life. And then people don't take action and they don't benefit from these fabulous plans because sometimes it's like a small hiccup that prevents them from participating. Did you say that people can join the group um, online? Is it available via Zoom for maybe people who don't drive anymore or who can't get out of the house for whatever reason? Or maybe they're actually a caregiver who's caring for someone who can't take the time and leave their loved one to go to a meeting. Can folks join online?
Yep, exactly. For all of those reasons and more, we have a virtual meeting option link. So it is a Zoom link that you can join to participate. And it's about an hour-long meeting. And like I said, there are these appointed members and there's these members of the community, but both voices are heard. There is enough room for us to understand and hear from people who are in the room and on Zoom and appointed or not appointed. So there is plenty of room for more participation, and it would be helpful, I think, to have that perspective, that stronger perspective in the room of the person with lived experience. So you can, and maybe I could share the link as well with you so that you can get it out to your listeners. But there's a way to view some previous meetings and meeting notes and agendas on the Secretary of State website. If you type in the Advisory Council on Alzheimer's, I think that's how you'll be able to find us.
That would be awesome because I think the more the community helps create something that is for the community,
Mm-hmm.
the stronger the program may be.
Yeah. Yeah. And a lot of it too, Deb, is about even just language. I was in a meeting once and I kept using the term brain health and thinking that people would sort of know what that meant. And I had a caregiver who was in the meeting with me, and she said, "Does brain health mean Alzheimer's disease?" And I thought to myself, well, yeah, of course, it includes Alzheimer's disease. But
Right.
um, I think that there's this, it can be hard sometimes working in state government or really elsewhere where you use these terms regularly and you know what they mean and you know what you mean by using that term, but the public does not. So it's a nice kind of check for me to think about what language am I using, who is the audience, and how am I explaining things so that it really makes sense, because that is important.
Right. So when doctors talk to other doctors, they speak very differently than when they're speaking, or hopefully are speaking differently to their patients, to ensure that the message is communicated effectively. That's one of the things I really enjoy about Friday Friends is, we can come on and have these great conversations and try to help put things in perspective for anyone who's watching, of like, how do the pieces really fit together? How do you really get involved? That's one of the things I love about this show. So Alzheimer's, the state plan, when is it due for renewal, and who's paying for this?
Yep. So we seem to update our estate plan just about every 5 years. So last
Okay.
update in 2019. We're currently in the process of getting to a new update that would put us at 2023.
Yep. And so much changed from between
Exactly.
then and now because of COVID. It's like it's almost like, in a lot of ways, the data that existed before COVID is specific to what happened before COVID, and what's happening now that COVID has passed through our lives. So much has changed.
Yeah, it's true. Yeah, we do, especially when we're using data to explain things. It's almost like you have to pull out, these were the COVID years, these were the pandemic years. And in some ways, we're really still in it. But there were so many changes just within the health system. You couldn't go see your eye doctor. You couldn't, there were so many things that were happening. So we do make an effort to sort of pull out, this was the pandemic. We were really in it during these few years, and the data does, I imagine it looks very different from pre to post, and now wherever we are now, endemic, pandemic.
And when this plan is being created, it's not just specific for individuals who have Alzheimer's related dementia. It is frontal temporal. It is Wernicke-Korsakoff. It is vascular dementia related to brain injuries. Is that correct?
Right. It's all forms of dementia. So it's not just Alzheimer's. And I think that can be confusing to people sometimes.
Right.
Alzheimer's is a form of dementia. You can think of dementia as sort of a umbrella term to describe all of the various kinds, Alzheimer's being one of them. But there are other vascular, frontotemporal, just like you mentioned, that would be addressed. The other thing that is addressed in the state plan is not just people living with dementia, but also caregivers of people who have dementia. And also a real focus on, I'm going to use this term again, brain health, which is sort of thinking about, how do I care for my brain as a 20, 30, 40, 50-year-old, and even before that, and sort of thinking through, what are the things I could be doing earlier in life that might prevent me from having memory issues or dementia down the road? There's a lot of research in this area. We in public health call it risk reduction. And that essentially means reducing your risk, right, of having chronic disease and having Alzheimer's disease and other forms of dementia. So we know scientifically through research that things like eating a healthy diet, physical activity, keeping your brain active. And that doesn't just mean doing a crossword puzzle. It means learning something new, learning how to play piano, learning a new instrument, learning a new language. Those are like real ways to keep your brain very strong. Crossword puzzles are good too, but there are things you could do, like really learning something new is good to keep your brain healthy. And
how about teaching? If you can teach something, is that helpful too? Because I'm thinking that there's people out there who have some really cool skills.
Yeah.
And they could like volunteer to use their skills, or would the teaching fall under helping to remain engaged? And that is good for your brain.
Yes, staying socially active. But I imagine teaching would be something that helps your brain stay strong over time. There's so much learning in teaching, right? Because you have, planning a lesson and then figuring out how to facilitate that lesson. So, yeah, if you have a cool skill and you want to teach someone that, I think that's a great way to keep your brain strong. But we're including some thoughts about how to keep your mind and brain physically active, how to keep your body physically active, what types of diets might be helpful for you to consider. And so that is sort of a part of the state plan that maybe historically wasn't a part because we've learned so much about the things you can be doing earlier in life to really reduce your risk. So when I say brain health, that's sort of the all-encompassing, you actually don't even have the diagnosis yet. You might not even be at risk yet, but what can you be doing now to really keep your brain healthy? And a term that I've heard a lot in the last 5 years that seems to be getting more popular is what is healthy for your heart is healthy for your brain. And we talk a lot about heart health, the American Heart Association. They have a ton of information about this, right? So we in the brain health world have sort of said, what's healthy for your heart is now healthy for your brain.
That makes sense. That totally makes sense because, and if we think about the prevention activities, it's kind of like wearing the seatbelt in the car. It doesn't mean you're not going to get into a car accident. It doesn't mean that you might not get injured if you were in a car accident, but it definitely reduces the probability of really catastrophic impacts of a car accident if you don't have a seatbelt on. Kind of like that. We don't want to, if there's ways to prevent a catastrophic event in our brain, then maybe that's something that we should all kind of take a look at. Might not necessarily, just like, the seatbelt sometimes isn't comfortable, sometimes it's scratchy, it's funny with a bulky coat, but it keeps you safe. The same thing, maybe getting out and going for a walk may not feel the most comfortable, or eating the fruits and vegetables might not be your favoriteest thing in the world to do, but it's helpful.
Yeah. Wearing your helmet on your bike.
Yeah, exactly. Yeah. So all these different things. And this is all part of the state plan on aging. I'm sorry, state plan on Alzheimer's?
Yeah, so there will be different sort of sections that look at brain health, just sort of generally, and then people who are approaching or have received a diagnosis, and then there's also this real focus on caregiver burden, and also caregiver resiliency. Being a caregiver is such a challenge, and that there are also some really wonderful things about caregiving, and part of it is that resiliency aspect of it. So I like to use that term instead of burden. No doubt caregiving is hard, and we value all caregivers out there, but I think there's this shift maybe of thinking about it as resiliency instead of burden.
I like that.
So just again, thinking through like what language are we using, right, to describe this kind of stuff. And then also thinking about workforce. That's another big challenge. So those will be kind of all the parts of the state plan. And again, the state plan guides statewide decision making and also guides some prioritization in terms of the Alzheimer's program at the Department of Health, and the things that we focus on will be very similar to what you'll see in the state plan.
And so somebody popped in a question. I'm not actually sure, and maybe they'll add a little more detail. The question was, what about caregiver abuse? And I'm not sure if they mean the individual with dementia is experiencing abuse, because that would need to be reported to the Office of Healthy Aging, even if you just have a suspicion of someone over the age of 60 who's being abused. You'd have to call that into the Office of Healthy Aging at the 401-462-0555 number. But sometimes with dementia, there could be some behaviors that are perhaps not the kindest to their caregivers. So will the state plan include supports for those caregivers who maybe are experiencing some challenging behaviors as they care for their loved one with dementia?
Yeah, I don't know if the state plan will be so specific to that
Mhm.
exact example, but it will definitely think through what resources are available to caregivers. On the flip side of that, the Alzheimer's program within the health department, which is the program that I oversee, we are looking to create, I'm calling it, again, this term brain health toolkit, that would sort of walk you through the different stages of the disease and how to navigate the disease process with a real focus on if this is happening to you and you are the caregiver, here
Mhm.
are some resources for you. The number one resource that I always direct people to is the Alzheimer's Association. They have a 24/7 helpline. I wish I had the number memorized, but I'm sure we can get it out there to folks. That is staffed 24/7. It doesn't matter if it's midnight, 2 in the morning, someone is going to pick up the phone and help you through whatever challenges you're experiencing. And it's been a very, very helpful to caregivers all over. And it's I'd like to say it's a number that people actually pick up the phone because I think sometimes caregivers especially are, strained and they don't want to call a number where you're going to sit on hold or have no one pick up. So they really do pick up, they really do help, and it's a resource that I often refer people to.
Yeah, even in the middle of the night, I have to say,
Mhm.
because sometimes, individuals who have dementia can mix up their days and nights. And so they are available literally 24/7. Right now, with the holiday season, there's a lot of disruption in routine. There's a lot of changes in the setting for individuals, and it can increase that distress for people with dementia and increase the stress of the caregivers. So yeah, calling that number anytime is reassuring that there's a human being on the other end of the phone. So
Yeah.
that's really good.
Yeah. And even if
Yeah.
you don't have a question, you just need
Mhm,
someone to talk to who isn't your family member or your
mhm,
neighbor, and they can really help you think through what your next steps would be.
mhm. Okay. And I just wanted to acknowledge, Jonathan, I do see your questions, and I'm going to do a private message for you separately so that way we don't have all your family's information in the chat for privacy reasons. I just didn't want you to think I was ignoring you out there. So I think there's a lot of good stuff coming for individuals and their caregivers. And will the training include individuals who work at different state agencies so that they're familiar with how to interact with an individual with dementia?
Right. Yeah. At the Alzheimer's program within the health department, we're actually partnering with Rhode Island College to develop training opportunities for people who work in within facilities and within the health system. But this training of other state agency staff, so that when you call a number that you might want support from, that they're prepared to answer your questions and help you through that process. Sometimes the calls get routed directly to my number, which is fine. And I'm happy to take any calls related to some of the concerns that you might be having or some of the challenges that you're having. And then again, the Alzheimer's Association, I always recommend calling them as well because they can really be helpful just in having a conversation with you about your needs. But my number, I think you can see at the bottom, and you're welcome to call me as well.
Yeah, that's the 401-222-7462. So if people wanted to give suggestions to the state plan on Alzheimer's, if they
Mhm.
wanted to join the meeting that happens every month, if they want to make sure that there is a unique situation that is considered in the state plan, they can reach out to you directly.
They can, or if you just want to chat.
That is awesome, awesome, awesome. Victoria, I am really glad that you were able to come on Friday Friends as we slide into the holidays this weekend. I'm glad that you had time in your schedule because with the growing population of individuals being diagnosed with Alzheimer's and related dementias, this is just going to keep getting bigger.
Yeah.
Yeah.
Yeah. Yeah, and this can be a really challenging time of year as well for people who are experiencing this and who are caregivers. So hopefully this gives you a little bit of a light in your tunnel
Mhm.
in thinking through that, Rhode Island as a state is headed in the right direction. I will not say we're there yet, but we are focusing on this, and we have really some dedicated efforts in understanding what we can do from a public health approach to address some of the challenges that we're seeing. So we're really lucky. We have a lot of great partners. There are a lot of really vocal community members who are sharing their story, and we are here to support and continue the great and important work in this space. So I'm really happy to be here, and thanks for having me this Friday.
Yes.
And a happy holiday to everyone who's listening. Hopefully your holiday season is calm and relaxing and rejuvenating.
Absolutely. Thank you so much, Victoria.
All right, take care. Thanks, everyone.
Well, everybody, we are sliding into the holiday weekend. Right now, it seems as though there's even a lull in the storm. So I'm hoping that if you have any last minute errands to run or anything like that, that you're able to go out and get that done. But keep in mind that it's not about the gifts. It's about that sense of connectedness. And if you're someone that perhaps you're alone this season, and that can happen, reach out to your local community, because there are community tables out there for you to go enjoy a holiday meal together. So I am really glad that you all were able to join me on this Friday, friends. I look forward to seeing you all again next week at the year's end, where we're going to talk about the successes that RI Elder Info has had this year. And they have been many. I look forward to seeing you all again next week. In the meantime, be well and be kind.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.